Hi, Dr. Ben. So my name is Madhu. I'll ask some questions about robotic knee replacement. Okay. So my first question would be benefits of robotic knee replacement. So could you share the key benefits of robotic knee replacement for patients compared to traditional methods?
Yeah, so there's a bunch of advantages of robotic knee compared to conventional. Advantages include being more accurate, being able to personalize component position. Dr. Vishal and team definitely showed that today, appreciating the patient's unique anatomy and then doing a knee to fit that unique anatomy rather than applying a standard of care for everybody. And also the ability to really be precise with those steps. You also can communicate, so you have a record of what you did, rather than sometimes our OR notes are a little bit generic and it's hard to define exactly what we did. We have a clear record. This is what we did, this is what we achieved, and then we know based on what the outcomes are, how we connect that to our intraoperative decisions and what we did. And then there's some evidence to say that shorter length of stay, less pain, less systemic inflammation will all occur with that robotic knee. And we're looking forward to more long-term data to see how it affects long-term how patients do.
Okay. So next question will be like global adoption. How widely is robotic knee replacement being practiced in countries like Canada or other parts of the world?
I don't know exactly with regards to the adoption of robotic knees, I don't know the exact percentages. Certainly registry data shows significant uptake. In Canada, it's happening more in higher volume centers, whereas in the States, it's happening more often in low volume centers as kind of a tool to attract more patients. Australian registry also shows significant uptake in more and more technology being used in total knees. I don't know the data for India. I hear there's a number of uptake, but I certainly, as I understand, the positron is one of the early adopters and certainly demonstrating thought leadership.
Yeah.
Next question will be technology difference. Our hospital uses an American robotic system. In your view, how does this technology differ from other robotic systems used globally?
The positron use of the VELYS is a very modern robotic system. DePuy, Johnson & Johnson call it a 4th generation robot. I don't know exactly what that definition means, but certainly it's a very modern, up-to-date robot that's relatively recently come out in Canada, around the world really. So definitely thought leadership in that way, and that it's a very modern robot that's certainly in a lot of ways right at the leading edge of robotic orthopedics. There's a number of different systems out there, but I do think that VELYS is right up there for being one of the thought leaders in it.
What major differences do you see between robotic knee replacement and conventional knee replacement surgeries in terms of precision, recovery, and outcomes?
So robotic knee replacements have a number of advantages like we talked about before in terms of being precise, personalizing, minimizing soft tissue damage, and enhancing recovery. It's hard to define exactly in your own patients to quantify that, but certainly literature consistently demonstrates those features of less pain, earlier recovery, and less soft tissue damage, as well as more precise adherence to, or more precisely staying on track and staying with the surgical plan.
Okay, so thank you. That's it from my side.
We at Positron, we are very glad to have Professor Lanting here from Canada, and the OR experience, sharing his insights in the OR was a great experience for all of us. And at Positron, we have been doing consistently now these robotic replacement system with the VELYS robot, and we have seen a very positive result in our outcomes in terms of early recovery. And patients are very happy. The analgesic requirement, the painkiller requirement is quite less, and most of patients are back to work within 2 weeks. So we are very happy that we are doing this surgery and providing robotics to our people. Thank you.
So today we have Professor with us, and we are very delighted. And he gave the insights in the OR. He basically, in the OR, we had a discussion how to improve for our patients, and we are very happy that he came here and at Positron Hospital. We basically thank him for he came in the Positron. Thank you.
I guess one of the highlights today and what's like a big positive for us is to know, like from your insights and what you've told us, that we are basically doing good, and there's not much of a difference, I guess, technically and in terms of what we can improve, and we are quite there at the cutting edge with the robot and with the technique and what else. So that's a great plus for us. Thank you.
Yeah.